a gay-related immunodeficiency syndrome. Later on, the name was changed to the present name called the acquired immunodeficiency syndrome. Basically, we have two types of this virus, HIV-1 and HIV-2. HIV-1 is very stubborn, highly virulent. If you get the infection and you don't intervene, the progression from the infection to the A stage is very fast. HIV-1, very virulent. Progression from the exposure to the A stage is very fast. HIV-2 to Africa and in fact West Africa. Less virulent compared to the HIV-1. In Africa, we are always fighting several conditions. And of course, we don't have only HIV-1. We also have HIV-2 as well. It is less virulent and it's not that common. So over in our case, you could have HIV-1 only, you could have HIV-2, or you can have a mixed infection. That is both HIV-1 and HIV-2. Elsewhere in Europe and America, they claim that it is only HIV-1 that they have. But when you come here, you can have HIV-1 and 2. The implication is that when it comes to some of the drugs that we use to manage this condition, some are not active against HIV-2. For that matter, if you diagnose anybody with either HIV-2 or a mixed infection, that is 1 and 2, then that class of medication, that is the non-nucleoside reverse transcriptase inhibitors, nevirapine, efavirenz, and the likes, cannot be used in such individuals. Now, let's look at the ACE proper. As I said, it happens during the later stages of the condition, where individuals will get the exposure and you don't manage it. All that it will do is to limit the ability to fight infections. Of course, your CD4 cell, that is the T pass, is the type to this virus, and eventually the numbers will decline, which means you are now vulnerable to other infectious agents. And then it is likely that you'll be having multiple opportunistic infections. Technically, the WHO defines ACE as when your CD4 count goes below 200 cells per ml, or when your CD4 lymphocytes, the percentage goes below 14% of the normal. Either of these two, then the person can be said to have the ACE. And of course, at that point, such individuals will be having complications, series of opportunistic infections, including toxoplasmosis and the likes. That is when we describe such individuals as falling within class 3 or class 4. Even cancerous conditions like Kaposi sarcoma, later you have the chance to look at pictures of such conditions, may even happen. So it's not only infectious conditions, but even cancer, the person can get it. Now, depending on the individual, the time from exposure to the ACE state or ACE stage could be very fast, or it may delay. In some individuals, they may even have the infection, but may not even be detectable. So let's look at the time that it would take for individuals to progress from the infectious stage or the exposure. And if no intervention is done, what duration as fast progresses. The the infection into the A stage within a year or 2 years. So 1 to 2 years after the exposure or after the infection, if you move to the A stage, you are classified as a fast progressor. This normal progressors. In these individuals, it takes approximately 2 to 10 years before they develop the A's after the initial infection. Then we have average progressors. In these individuals, 10 to 15 years. Then they will get. Then we have some category of individuals. Very few, less than 1% of those who have slow progressors, long-term slow progressors. It takes over 15 years for them to move into the A stage after the initial exposure. And very rarely, it doesn't happen, very, very uncommon. A group called they have the infection. So they have the infection, viral load undetectable, CD4 count very high. If you are part of this, then you'll be classified as a late controller. Any queries? Last captain.
No,
Any
please.
queries? All right. So then let's look at. You have almost about. Hello?
People who
Global.
are not on the antiretrovirals.
No. If you are on antiretrovirals, then one of the key aims or goals is to make sure that you don't get to the A stage. So this is with those who get the infection without any. All right. So globally, you have about roughly, according to the 2019 WHO UN AIDS, their estimates, they are saying that about 30 million people, more than the population of Ghana, very serious. Out of this, 25.4 million were on antiretroviral therapy. So that is the global. When it comes to Africa, just narrow down from the worldwide view to Africa, then to Ghana. They are saying that 25.7. So out of the 38 million, there's 57% of those the infection that are actually aware that becoming worse nowadays. If you look at the number of people who visit the HIV clinic, how do they get it? I'm excluding myself, so I'm using they. How do they get it? So modes of transmission. You can get exposure to the infection through body fluids, for example, blood and blood products. So if, for example, you are in the hospital and it's necessary for hemotransfusion, as an example, and the blood is not well screened, or any other blood product that is not properly screened, you could get the infection. If you are the type that you fire left, right, center, indiscriminate sex, the worst case is when you do it without protection, no condom. So unprotected sex. You may by all means meet an infected person. So you fire everywhere, every town that you get to, you arrange for a match. You do it without condoms, no protection. If you're unlucky and you meet an infected person, especially those in the early stage, the seroconversion stage, or the latter stage, if the person is having high viral load, then you may be in trouble. It doesn't matter the method of intercourse. If the person has a high viral load, you are always at risk. So either vaginal, anal, or oral sex, it is still a risky situation. Drug abusers, you're always at the joint, you're a ghetto guy, you inject drugs, you want to enjoy life. These individuals may exchange, and therefore, once somebody uses it and the person has the infection, and you use it right after that person, there is high possibility that you could be exposed to the infection. The unfortunate situation is the last one, vertical method of transmission. When a child gets it from the mother, either in utero during pregnancy or modes of transmission of the virus from individuals, one person to the other. Multiple sexual partners. And when you no protection, anal, oral, or vaginal. Parenteral drug administration or blood administration or blood product administration. You could even get an accidental needle prick as a health worker is having a very high viral load. In the following fluids, you may have or you have a lot of the virus staying there. Blood, semen from men, secretions from women, and breast milk all do contain count. It's normally blood, followed by semen from men, then vaginal secretions, and then breast milk. So this impact, if you compare the amount in semen to the amount in the vaginal fluid, this impact explains why females are at increased risk. Not only this explanation, there are others that we look at later. But the mere fact that semen contains high amount of the virus as compared to the vaginal secretions, it puts women at a higher risk of getting the infection as compared to their male counterparts. The good thing is that the virus is not found in saliva unless it is contaminated with blood. But clean saliva, you don't have the virus in it. Tears, you don't have it. Sweat, that is very good. If not, you could even get it when you are in trotro, especially during afternoon that the sun is very strong. People are sweating. You board the Trotsky with them, then you have contact. Then the sweat alone, if it has enough or if it has the virus, then the condition could spread easily. But thankfully, it is not present in sweat. Feces, no. Urine, too, no. Semen, vaginal secretions, and breast milk.
Anal sex. I believe the risk is higher in anal sex than vaginal sex. So if feces is not infectious, why is the risk higher with anal sex than vaginal sex?
So we are looking at the anatomy. If you look at the anus, you have less secretions. So the level of lubrication there is not the same as the vagina. During sex, you realize that the vagina will have a lot of secretions that provides lubrication. So the kind of friction that occurs within the vagina is far, far lesser than that will occur in the anus. So if you do anal sex, there is high possibility for you to get some injuries. So the injuries that you get is the one that will put you at risk. Both the one who is doing the insertion and the one who is the HIV. Are you okay?
Yes, please. Thank you.
All right. So, as you said, there is increase not only HIV that you can get if you do analingus. Remember, the feces and everything passes through there. So apart from the HIV, you are at risk of parasitic infections and even other viruses like hepatitis A and B. You can get parasitic infections from licking somebody's anus. Then fingering, if you finger somebody, depending on whether you have some sores around your fingers or not, you can also be exposed to the infection. That is digital anal or digital vagina. So you can finger the vagina or you finger the anus. This is fingering. Any of the above can predispose individuals to the infection. But what is the relative risk? As the class captain said, the receptive anal, if you are doing anal sex, the one who is somebody who is receiving the penis through the anal route versus somebody who receives the thing through the vagina. So receptive anal sex is the one with the highest risk, even as compared to the receptive vaginal person. Obvious reasons, as explained, reduce lubrication within the anus. If you are to compare anal sex again versus, so another evidence is that if you are comparing anal sex, so the insertive one to the recipient, so the one who inserts is at lower risk. So normally males, if you are not a gay, you normally do the insertion. So you are also at a lower risk. So receptive anal sex is riskier as compared to the insertive anal sex. So the one who is receiving through the anus is at increased risk as compared to the one who is doing the insertion. Then if you compare receptive vaginal sex to insertive vaginal sex, obviously the one who receives when it comes to vaginal sex is also at risk as compared to the one who will do the insertion. So obviously, the implication here is that females, again, are normally at the receiving point or the receiving end. And with this, it also adds to the earlier one that we said. This also partly explains why females are at increased risk of the condition as compared to their male counterparts. Whenever you receive, you are at the receiving end, you are always at an increased risk as compared to the person who receives. But anal recipients, they have the highest risk, even as compared to the vaginal recipients. And therefore, let's look at why women are said to have higher risk as compared to their male counterparts. Biologically, women are vulnerable to the infections because even looking at the anatomy, they have very wide mucus or surface, makes it easy for them to get the infection. Among the women population themselves, if you are below 17 years, younger females, especially those below 17, at even a higher risk as compared to adult females. And then, so don't be like Lionel Messi and those young guys who are exceptional. We know you are good. But when it comes to HIV, delay your debut match, delay your first match. Because if you do it too early, it even increases your chances of getting the condition. Again, as we have discussed earlier on, semen has a higher levels of HIV content. If one man has the condition, it can easily spread to so many women. Then, economic hardship. If you are to compare males to females, in most cases, you realize that in terms of cash issues, males are better than females. And of course, if you don't have cash and you try not to work hard, then you have to follow the men, become a slave queen for cash. And therefore, this will put you at risk. If you want to get 10,000, 20,000, 100,000 per match, then by all means, somebody is ready. We have some wicked people who are around with a condition. They will pay you anything that you want from them. They will pay you only for them to give you the infection. So social and economic pressures of poverty. Women do like competitions a lot. Social media, TikTok, they are just putting pressures on themselves. I do this, I have this wig, I have this shoe, I bought it at 5,000, this perfume. Women do like competition and therefore you follow cash. Unfortunately, those that you get this cash from them, most of them, they come with the infections. And all of this will put women at a disadvantage as compared to their male counterparts when it comes to the infections from HIV. Any queries? Any queries? Class captain.
No, please.
All right. So relax. When it comes to issues like shaking somebody's hands, you are not going to get the infection if the person is positive. If you eat together with them or working together with them, you hug them, casual kissing, not the intimate one. If they sneeze on you, you touch an intact skin. Maybe they have become patient and you are trying to do examination and there is the need for you to touch them. No fears. Even if you share cutlery with them, no cause for alarm. You use same toilet seat with them, no fears. Even mouth-to-mouth resuscitation when it comes to critical conditions. Don't fear. These are all myths about HIV transmission. But